Hospitals are still promoting normal births despite NHS guidelines. I'm going to read into this exclusive from iNews, you guys. Let's go. Good morning, good afternoon, good evening, wherever you are in the world. This is Reganelite here with an exclusive from iNews with the headline, "The hospitals are still promoting normal births despite NHS guidance. Some hospitals are still seeking midwives who will promote the practice despite change in guidelines after a series of safety scandals." Guys, while you're here, make sure you hit the like button and share it across social media so others are notified of this video. We'll read into the definition in the exclusive about the guidance of normal births. But obviously, some of the hospitals who are still promoting a practice that hasn't been, despite the NHS been serious, that haven't been declared or seems safe, especially after safety scandals, is certainly questioning. Now, of course, it's really important that those mothers and women are able to be given birth in those hospitals, but if they're not deemed to be safe, and especially when there has been a series of scandals around the safety and protections of women, understandably so, that those same hospitals should be put into question about whether they should still be promoting them or not. And hence this is where this exclusive has come about. We need to ensure the safeguards of all patients, regardless of whatever care it is in hospitals. And we know that based off the NHS's history and the underfunding and whatnot of the Conservatives, we know that the NHS has struggled to maintain the standards it used to be. It has been overstretched, it has been exhausted, and it has been depleted, which has led to many unfortunate more losses of life than there needed be because of the situation it has been put in. So let's read a bit more into this, you guys. So, NHS hospitals are continuing to advertise jobs seeking midwives who will promote normal births despite official guidance, the Eye has learned. So after a series of safety scandals involving avoidable deaths of mothers and babies, hospitals were ordered 2 years ago to stop promoting normal births, a term for vaginal births without medical assistance, in the pursuit of bringing down Caucasian section rates. But the Eye has seen 8 adverts placed in 2024, some as recently as this month. They include statements suggesting midwives will be expected to promote normal births or physiological births. The term normal, physiological, and natural births are generally used to interchangeable to mean a vaginal birth without any medical assistance. That's quite shocking that they would do them without medical assistance. There should always be without medical assistance, there should always be the greatest of caution when it comes to bringing children into this world. Why are there not these cautions there? And unless West Streeton has said that something has changed since then, it's changed since 2 years ago. Maybe he has said something behind closed doors. I don't know. But something has definitely changed here, that is for sure. In 2022, NHS England told all hospitals not to put women off having Caesarean sections to boost their rates of vaginal births. An official guideline says women have a right to choose Caucasians even if they have no medical need. Caucasians can be life-saving if the baby gets stuck during labour. That being said, they can also take longer to recover from the risk and raise the risk of infection and complications in later pregnancies, research has shown. So when approached by the Eye, some of the hospital trusts said they would change the language used in future adverts. The Royal Free London Hospital, for instance, placed an advert for a midwife that closed this month and said normally in midwifery is the main focus. A spokesperson said the phrase had been used in error. The phrase is not included in various vacancy adverts, the spokesperson has said. Ensuring the safety of women and their babies is the absolute priority for all staff working in our maternity service. You can see that this is an advert for a midwife while at Maidstone and Tunbridge Wells NHS Trust here. Normality is promoted in all clinical areas. Other adverts similarly seeking midwives to promote normal or physiological births were placed this year in Bedfordshire Hospital, Medway NHS Trust, Caesarean and Huddersfield NHS Trust, Walsall Healthcare, Maidstone and Tunbridge Wells NHS Trust, Wolfishire Acute Hospital and North Middlesex University Hospital. Bedfordshire Hospital and Maidstone and Tunbridge Wells NHS Trust said that they would change future job adverts. Walsall Healthcare and Wolfishire Acute Hospital said safety was their main priority. The other three hospitals said either declined to comment or did not reply to emails. The findings come after a damning report on the NHS this month by former Labour Health Minister Lord Dudski said maternity services were particularly bad, citing evidence that the different healthcare staff have different cholelia. If I mispronounced words, I do apologise. The investigator who provides the evidence, Dr. Bill Cullip, has now told the Eye that he has referred to the fact that some staff training focuses on promoting normal births. So the term normal, natural or physiological births are often used interchangeably to mean a vaginal birth without medical interventions. A birth would not be classed as normal if a woman had an epidural for pain relief where strong drugs are delivered into the back, but most would still consider that it's a normal birth if the mildest painkiller or gas of air is given. If any instruments are used, such as forensics, to pull out a baby, this would also not be considered a normal birth. While other failings, including uncompassionate care and failures to investigate deaths, promoting a physiological birth regardless of risk, have been a consistent finding in the major investigation into foul maternity services, said Dr. Cullip, who carried out such two investigations himself. There's another advert there. This was for Walsall, saying our community midwives promote normality and the use of alternative therapies there. The Royal College of Midwives, the RCM, did not respond to a request for comment for this article, but in response to a further critical report on maternity service out this week from the Care Quality Commission, the RCM's Jill Watson said hospitals had too few staff with the right training, too little time to care for and listen to women, and crumbling infrastructure. Yet this latest DASI report on the NHS found that as staff members have risen and births have fallen, the number of births per midwife this year has dropped from 35 in 2007 to 26 in 2022. The DASI report acknowledged, however, that over that period, women's medical needs during childbirth have become greater due to factors such as maternal age and more women being obscured of having diabetes. An NHS spokesperson said the NHS has a duty to provide safe and personal care to women and families according to the best practice guidance and informed by evidence. And it is a fundamental requirement of maternity teams to inform and listen to every woman, respect their views and help them to achieve their type of birth that they would like. The Department of Health and Social Care spokesperson said women need to know that their wishes are being respected and listen to what is being listened to when giving birth, and it is unacceptable that too many women are not receiving the maternity care they deserve. I think it's really, really important that the sectors where they have failed the most in certain hospitals and trusts, where those trusts literally have been broken in terms of maternity care or have been the poorest, there must be the most absolute care and medical assistance without a shadow of a doubt for them. I'm going to go on a limb and say they probably have reviewed those ones that have failed, or they are still looking into the reviews of those who have been the most failures there. But it is obviously concerning that they are advertising jobs, but at the same time, it's like, well, if they're told they're not allowed to, they were ordered 2 years ago to stop promoting normal births, so they're using the term normal births, so they're using a different term for it. So are they like they haven't been told to stop doing the practice, basically, even though that they have even though they have fundamental failures in some of these trusts. And they've just simply changed the wording on them. I don't like this at all. I don't like this at all because I am more, for me, the number one priority is the safety of women and the babies obviously coming into the world. It's a very concerning tool, to say the least here. I don't know enough about it myself, not gonna lie to you guys, but I do think that any and all access to whatever women need when it comes to the birth of their child should be given, and the NHS, the trusts and the hospitals and those who are looking after them during that period should be able to know their job, know exactly what they need to do, and be able to respond appropriately in that very important time for them. But what do you guys make of this story? What do you guys make of the hospital still promoting normal births despite the NHS guideline on it, according to this exclusive from the Eye? Let me know your thoughts and more down in the comments section below. If you found this video informative, please hit the like button. We greatly appreciate it. Share it across social media so others are notified of this video, and subscribe if you haven't, because it really does help support the channel. And if you want to go one step further, financially support me and the work that I do here, you can do so by becoming a YouTube member for as little as 99p, or join me on Rumble or Patreon for exclusive content on those platforms. So thank you all so much for watching, and I hope to catch you all very, very soon.